Good morning, I'm Ken and I'm coming from Applied Chemistry Year 2. Today, my presentation title is The Effects of Omega Fatty Acids Can Reduce the Risk of Cardiovascular Disease. And in the following slides, I will use CVD to instead of the full name of cardiovascular disease due to convenience. Here comes the outline of the presentation. First, I will give a brief introduction of what omega fatty acid is. Then, followed by the body of the topic. This is the background information and the knowledge from the research paper. And the purpose of my research and the conclusion will be included. And the last part is the Q&A session. Health is a very important aspect nowadays, and when comparing to wealth, health is far more important since when health is absent, even though you have lots of money, this is useless. And cardiovascular disease is a very common disease in the Western countries due to the high proportion of fat in their diet. And interestingly, omega fatty acid is also a kind of fat, but it can reduce the risk of CVD instead of induce it. There are two main kinds of omega fatty acids. They are omega-3 and omega-6. It depends on the location of the first double bond. Omega-3 has the first double bond located at the third carbon atom, and omega-6 has the first double bond on the sixth atom. And apart from the double bonds, they have one carboxylic acid group instead. And there are only 4 kinds of omega fatty acids that have the therapeutic effect. They are EPA, DHA, LA, and alpha LNA. EPA is the eicosapentaenoleic acid, DHA is the docosahexaenoleic acid, LA is the leonine acid, and alpha LNA is the alpha leoninic acid. And this is the structure of the LA and alpha LNA. They are examples of the omega-3 and omega-6 fatty acid. Fish and fish oil supplements are the main sources of omega fatty acid. Examples are included salmon, tuna, and herring. And interestingly, omega fatty acid are rarely found in the terrestrial animals. And alpha RNA can be directly converted to EPA, but the reaction is very slow and limited in humans, so that we obtain EPA from the outside sources instead of generation from our body. Omega fatty acid has many potential functions. They can reduce the risk of sudden death, they can lower the blood pressure, they can decrease the triglyceride level and prevent the triglycerides from aggregation, and importantly, they are the main components of membrane and tissue, so that the phospholipid level can be used as the indicator of omega fatty acid. And also, they can maintain the membrane fluidity and the ion transport. Here comes the purpose of my research. Since the mechanism of how omega fatty acid reducing the risk of CVD is unknown, so my purpose is to find out the mechanism. But there are many proposed mechanisms in the journals. They include the inhibition of the fast-depending sodium current and reduce the fatal heart rate. And heart rate is a very important predictor for the sudden heart death. And omega fatty acid can significantly reduce this risk. And here comes the procedures of our experiments. Our experiment is to find 3,000 of CVD patients and check the body situation first. For example, we can check the triglyceride levels, check the blood pressure, check the heart rate, or even the velocity of the sodium current. Then give them the same amount of omega fatty acid every day continuously, and check the body situation again after 6 months to see that which factor it can be significantly improved. So I can conclude that the mechanism of the omega fatty acid. There is additional evidence to show omega fatty acid can reduce CVD. 2 articles point out that the Greenland Eskimos have a remarkably reduced rate of the acute myocardial infarction. And myocardial infarction is a kind of non-fatal heart disease and less serious than the coronary heart disease. And even though the Eskimos have a very high intake of fat, similar to the Westerns, they have a very low rate of this MI because they have a very high intake of omega fatty acid instead of the saturated fat, which can harm our health. By the American Heart Association, they have recommended that for the normal adults without documented coronary heart disease, they should eat fish for 2 times a week. For those with the coronary heart disease, they should intake 1 gram of EPA per stage A per day to prevent CVD or cure them. After reading all the 5 journals, I have found some inadequacies of the research paper. Some research paper only conduct experiments for women instead of the both side men and women. This is a bit unfair and unbalanced. And some papers use very uncertain. They may or may not these works, and just copying from the other research paper or the previous research without any experiments or verification. Here comes our conclusion. The conclusion is that there is a very strong evidence to show the inverse association of omega fatty acid and CVD, but since the mechanism is unclear, so additional research is needed. But in my point of view, I think omega fatty acid can be used as a target medicine to cure the CVD, and it may become a breakthrough for the future science. Now, after finished my presentation, I would like to talk about my progress of assignment 3, since assignment 3 and assignment 4 are interrelated. I have finished all the 5 journals and start writing the introduction of the literature review for the part of making topic generalization. And I finished 1 annotated bibliography, and when comparing to other assignments, I think assignment 3 is much more difficult than the other. Okay, this is the end of my all presentations. Thank you for all your attention, and here comes the Q&A session.